Chronic kidney disease by definition means there is chronic damage to the kidney. If you look at international definition, we measure chronic kidney disease by what is called as GFR, that is the filtration by the kidney. The normal GFR should be more than 60. If somebody has a kidney function GFR less than 60, and if it is persistent for more than 3 months, we classify them as chronic kidney disease. Some people, even with more than 60 GFR, come under chronic kidney disease if they have any protein in the urine, if they have any cysts in the kidney. They all fall under the category of chronic kidney disease. This is only to make people aware that they are at risk of developing further kidney damage. It is the most common cause of chronic kidney disease the world over is diabetes. Mm-hmm. If we look at international numbers, including our unit, dialysis patients, 50 to 60% of damage to the kidney, that is permanent damage, is due to diabetes. Number 2 cause is hypertension. And later comes other diseases like what we call as interstitial disease and congenital disease, as you mentioned, genetic disease and hereditary disease. In our country, we also see chronic kidney disease due to some unexplained reasons, like people take over-the-counter medicines, some native drugs which are not monitored. We don't know what they have, and we have seen people developing unexplained renal failure. In fact, now that has become a significant reason. We call it as CKDU, that is unknown. So that is quite more in our country. What causes it, whether it is environmental factors or some chemicals, toxins, pollutions, still a lot of research is going on. The problem with chronic kidney disease is you don't get any symptoms related to kidney disease. See, it is not like you get a chest pain and you go to a cardiologist, he detects some blockage and opens it up and you're saved. Kidney, unfortunately, what happens is you don't get any symptoms at all. By the time people get symptoms and they seek medical help, more than 90% of kidney is damaged. Meaning, suppose they get some swelling of the legs, swelling of the face, or they're not passing urine, they don't feel like eating, vomiting, and sometimes we call it as unexplained anemia. These are all the features of renal failure. But by the time these symptoms are detected and you seek medical attention, 90% of kidney damage would have already happened. So you cannot reverse it. Since you seek the attention very late and you cannot reverse, this is called a silent killer. We suggest screening in people who are at high risk. Okay. First and foremost is diabetics, as you mentioned, annually if they have problem once in 6 months. People with hypertension, especially if they are not under good control of hypertension. People with family history of renal disease, like to rule out genetic disease, or they are prone for genetic diseases like polycystic kidney disease, or somebody has some glomerular disease. These are all the high risk people. So high risk people would include diabetics, poorly controlled blood pressure, obese individuals, chronic smokers, family history of renal disease, or very elderly people who are again having a lot of other issues like cardiac problems, anemia. All these are connected. In fact, heart and kidney are connected. When anybody has heart problems, they need to check for kidney. And if they have kidney problem, we check for heart. Chronic kidney disease as stage from stage 1 to 5. Stage 5 is stage what we call as end stage renal disease, when kidney is damaged more than 90%. That means the filtration rate has come down to less than 15 ml. That's the stage when people will need either dialysis or kidney transplantation. Okay. So when kidney is damaged more than 90%, people will need dialysis. Only way to replace kidney is to do either dialysis or transplant. To some extent, yes, especially when the kidney functions are deteriorating, too much of protein and other things, if we cut down, definitely it will delay the progression of kidney disease. And as we all know, too much of salt will again increase the blood pressure, and high blood pressure can cause the damage. So if somebody is very careful with their salt intake, nutrition, reduce the protein intake, they can definitely prevent further damage and also probably delay the progression of disease. Suppose somebody needs dialysis in 2 years, you can delay it for 5 years. First and foremost is probably don't take unnecessary over-the-counter medication unmonitored. And if somebody is at risk, do annual screening or semi-annual screening. And if you have diabetes, hypertension, keep it under control. And obesity is the new pandemic which is going on. So we need to cut down on obesity, and of course smoking. And in the recent times, as we mentioned, sugar is new smoking. So probably cut down on too much of carbohydrates and sugars, which may add to weight gain and diabetes onset and things like that, which will go a long way in preventing kidney damage.